Good morning, everybody, and welcome to the beautiful campus of Coppin State University. I want to recognize Coppin State University's president, Dr. Anthony Jenkins, who was here today, and give a big thank you, Mr. President, for allowing us to be on your campus, allowing me to be on your campus for the third time in probably less in it's few days, actually. I am for this most important announcement this morning. We all know the great work that Coppin has done throughout its history here in Baltimore and West Baltimore, not just for putting out the amount of teachers and nurses that they have, but for making sure that people in Baltimore, many who did not take, Mr. President, the traditional route to higher education, actually have a great place to learn. So thank you. And if you haven't, and I'm glad the members of the media are here, if you haven't seen the transformation that West Baltimore is taking, much of that with the support and the push, and as you can see with Coppin State University, everyone now knows. I am also joined today by our City Administrator, Chris Shorter, our Health Commissioner, Dr. Zaraza, our Chief Recovery Officer, Shemaya Kearney, Holly Frastat, our Food Policy Director, critical staff from the Health Department, and our Deputy Mayor for Equity, Health, and Human Services, Faith Leach. Thank you all for being here today. This is a very special day for Baltimore. As everyone knows, our city received $641 million in American Rescue Plan Act dollars. The city has now received the first half of these funds from the U.S. Treasury Department, dollars designed to help jurisdictions maintain their response to this public health emergency and provide relief to residents and businesses. First, let me express my gratitude to our federal delegation for their strong advocacy and support. I say it often, I'll say it again, that we have the best federal delegation in the United States Congress. I also want to express my gratitude to both President Biden and Vice President Harris for understanding that the country and cities needed this direct funding in order to help us continue to deal with this pandemic and come out on the other side. We are here today to make the first, not the last, the first in a series of investment announcements focused on the administration's top priorities with American Rescue Plan dollars. This is why I established the Office of Recovery Programs, which has built a strong infrastructure to transparently account for these dollars and share both with our residents and our federal government how we are spending it. This is also why we open a funding portal for Baltimore nonprofit organizations who want to take part in this historic investment in our city, which is open until the end of the year at arp.baltimorecity.gov. And we know when you think about Baltimore's history with federal dollars, we know that it has not always been a pretty picture. And this is why we stood up the Office of Recovery Program so that we will not have those things happen on my watch. We will do everything by the book to make sure that we are spending these funds appropriately. Now, you might ask why, and that's why we're here today, not in the War Memorial Building or inside City Hall, but on the campus of Coppin State University here in West Baltimore. As I said earlier, a true community-based educational institution. And why are we here in front of the Health and Services Building? Because one of Baltimore City's Health Department's free vaccination clinics open to our residents is taking place inside of this building. It's appropriate because the American Rescue Plan, or ARPA, is about addressing the COVID-19 public health emergency and its negative economic impacts. It's appropriate because we are excited today, and I am very excited to announce the first of our investments that will focus on preserving the public health of our residents. The Baltimore City Health Department will receive $80 million over the next 4 years for the fight against COVID-19 and beyond, ensuring the health and well-being of our residents as we continue to navigate this pandemic. The investment will provide tens of thousands of at-home laboratory and rapid COVID-19 tests and dedicated testing staff to continue our citywide public testing program, provide for the purchase, management, and storage of personal protective equipment, or PPE as we know it, provide funding to develop telehealth infrastructure for our Baltimore City healthcare clinics, helping modernize our much outdated systems, support 120 contract tracers and supervisors, create an immunization office to coordinate and increase vaccinating rates among our most vulnerable and hesitant communities, build a mobile vaccination team of 24 to reach all areas of the city, and this investment will also add additional caseworkers and social workers to protect our seniors from violence and abuse, which has been exacerbated by this pandemic, and further our efforts to combat food insecurity, or as our food policy team puts it, ensure nutritional security for our residents. Contained within the investment announced today is funding for more than 20,000 fresh meals each month and 1,200 grocery boxes per month, and food delivery service for our seniors and homebound populations. This work has been possible because of the partnership that we've had and built throughout this pandemic, and we are grateful to every single partner, community, collaborator, business, and individual who has played a role in developing and carrying out this strategy. And before I turn it over to our Chief Recovery Officer and to say a few words about ARPA and this process, I want to talk about what's to come. In the weeks ahead, I'll be making more announcements focused on other top priorities as mayor for these dollars. I look forward to sharing those with you in the very, very near future and ensuring we get this critical work underway for the benefit of Baltimore. We know the need in Baltimore was great, even before COVID-19 showed up on our doorsteps. And we understand that that need has only grown dramatically. Yet, Chief Recovery Officer Kearney and I agree that if Baltimore is unchanged after the investment of these dollars, then we have not done our job. My focus will remain on ensuring we can trace the impact of these dollars and that the public can clearly see how they're being spent. I sincerely believe in the bottom of my heart that if we make investments in the right way, we can make a deep and genuine impact. And now let me turn it over to our Chief Recovery Officer and Director of the Mayor's Office of Recovery Programs, Shamaya Kearney. Shamaya?
Thank you, Mayor. I'm Tanya Bobolinichi. I'm the Chief Recovery Officer for the Mayor's Office of Recovery Programs. The Mayor's Office of Recovery Programs was established to administer $641 million in one-time funding that the city received from the American Rescue Plan Act. We, the Mayor's Office of Recovery Programs, and this administration are committed to executing this mission with a focus on impact, transparency, equity, accountability, and responsibility. The American Rescue Plan Act clearly defines the programs and activities that are eligible uses of funds under the law, and directly supporting the city's response to COVID-19 through our public health institutions is one of the most important uses of these funds. The Mayor's Office of Recovery Programs has worked closely with city agencies, consultants, and nonprofits to solicit, design, and evaluate project proposals that will yield demonstrable results. The first $80 million investment in the Health Department's COVID-19 response is one of several initiatives to be funded by the city's ARPA allocation. I'd also like to talk a bit about how we plan to track performance. Performance tracking and reporting to the Treasury Department is one of the core functions of our office, and we firmly believe that a data-informed and data-driven approach is the key to ensuring that this one-time investment is utilized wisely and prioritizes equity for Baltimore's underserved communities. To that end, we've worked with the Health Department to track a number of key performance indicators that address each component of their ARPA-funded initiatives. For example, for testing and vaccinations, we're looking at the percentage of test positivity by zip code, race, sex, and age, number of clients served at mobile clinics, and the percentage of the population vaccinated by age and eligibility across the city. We're also tracking the reach and effectiveness of our contract tracers, how quickly our PPE supply is used, as well as a number of meals and food boxes distributed to our senior population. Those are just examples of some of the things that we'll be tracking with our health department as a part of our investment. We are committed to demonstrating a return on investment through data, and we welcome you to follow us at arp.baltimorecity.gov for continued information on how we're doing with our ARPA allocations. I'll turn it over to the Health Commissioner.
Thank you, Director Kearney. We're very proud of the work that you've done in such a very short period of time. And now we want to bring up, and I'll say it again publicly, our Health Commissioner, Dr. Jaraza, who has led and helped lead this city through the COVID-19 pandemic in a way that I don't think anyone can complain about Dr. Jaraza's leadership. Having our city be recognized as a city that's handling the pandemic better than most is something that we can attribute directly to her fearless leadership. And Dr. D, I also want to thank you publicly, even though I did it yesterday in a private meeting, for helping guide me through my COVID recovery and answering all my questions and concerns to make sure that I'm able to continue to work, but also to get back healthy in the appropriate time. And I'll turn it over to Dr. Jaraza.
Good morning. Thank you, Mayor Scott, and thank you, President Jenkins, for allowing us on your beautiful campus. I would like to take a moment and just acknowledge the significance of where we are today, the campus of Coppin State University. Coppin has been a key partner to the city throughout the pandemic. Their nursing students helped to vaccinate many of the first eligible residents here in the city back in January, including our first responders and medical personnel. I, too, was vaccinated by a Coppin nursing student. So I'm very proud to be standing here today in front of Coppin State University's Health and Human Services building, all while a city-supported vaccination clinic is currently taking place. This event is supported by our partners, as well as the amazing health department staff who have been working so hard since the pandemic began. I want to personally thank the mayor and city leadership, because today's American Rescue Plan Act funding announcement of $80 million over the next 4 fiscal years will provide ongoing support for my staff's Herculean efforts. These ARPA funds will support the health department's continued COVID-19 response work, while also creating a more robust department that's even better positioned to tackle current and future public health challenges. The coronavirus pandemic has affected every single resident here in Baltimore City. But perhaps no single city agency has felt its effects as acutely as the Baltimore City Health Department. Our team is composed of individuals who have put their families and personal lives on hold in order to support the city's public health response over the last 19 months. In that time, we have seen incredible successes. Our mobile testing units have set up hundreds of testing sites across the city, serving tens of thousands of residents, informing them of their COVID status, and providing much-needed information on how to safely isolate and quarantine. Currently, 68% of all eligible city residents have received at least their first or single dose of vaccine. Week after week, our team continues to reach residents with vaccines, consistently increasing our vaccination rate. Our mobile vaccination units recently crossed the milestone of 1,001 vaccination clinics held or supported by the Baltimore City Health Department since we began vaccinating in December 2020. Our teams have supported many different types of vaccination events, from mass vaccination sites early on this year to our first mobile vaccination clinics within congregate living settings, and now our community-based clinics that bring vaccines directly to residents in need. Much of the health department's success has happened behind the scenes. The ability of our teams to deploy these resources have always been supported by the data. Our dashboard has been a tool not only for residents to monitor how we're doing in real time, but also to ensure that we deploy our resources to where they are needed most. This ever-important background work has been done by our epidemiologists and data analysts who continue to respond to normal health department requests in addition to the needs of the pandemic. Likewise, our environmental services staff have helped inform businesses of the latest health orders to reduce disease transmission, performing outreach on a weekly basis on top of their normal health inspection duties that keep residents safe. Similarly, our internal operations divisions, such as human resources, finances, and IT, have been critical to supporting our ability to hire rapidly, and their functions ensure that our frontline teams have adequate resources to do the work. I wish I could individually give everyone within the health department an award, because everyone is so deserving. I'm able to stand here today because of what they have done for the past 19 months. However, today I do have the privilege of honoring a few key staff members who've been involved with our pandemic response. These individuals epitomize the work ethic and dedication demonstrated by all of our staff at the health department. The first person I'd like to honor is Ms. Tanisha Evans. Ms. Evans was first hired as a community health worker to support the Maryland Access Point Care Coordination Team in November 2020. She began conducting outreach at senior housing buildings across the city to help connect older adults to resources, including signing up older residents to get their flu shot within the convenience of their home. Her work with the residential coordinators and older adults residing in those buildings helped to build trust within the community. Ms. Evans was instrumental in assisting the department to reach 100% of the senior housing buildings in the city during last year's flu campaign. She has subsequently transitioned into our mobile response unit as a community health worker supervisor. She continues to support and train a team of community health workers to conduct outreach and mobile vaccination efforts. Thank you so much, Ms. Evans, for your service. Next, I'd like to honor Ms. Tanya Bobolinichi, who can't be with us today because she's working. She is in our Office of Acute Communicable Disease, and she has been supporting the pandemic response since January 2020, when she first started receiving phone calls and emails from individuals who had traveled during the Chinese New Year. Ms. Bobolinichi is an experienced disease investigator in the Office of Acute Communicable Diseases, and she was among some of the first to evaluate those earliest cases of COVID here in Baltimore City. She organized and oversaw a team of health department staff who manned phone lines and answered questions from the public long before we had officially launched our COVID call center last spring. Ms. Bobolinichi provided mentorship to health department staff who were reassigned to case investigation and outbreak work in the spring and summer of 2020. She also supported new Baltimore Health Corps staff as they were hired and onboarded to the COVID outbreak team. Ms. Bobolinichi continues to oversee a team of outbreak investigators working to prevent and mitigate COVID transmission in healthcare and congregate care settings, including our nursing homes, assisted living facilities, and correctional facilities. Last, but certainly not least, I want to honor Ms. Winella Taylor, who also can't be here because she is covering one of our schools. Ms. Taylor is a community health nurse in the Bureau of School Health. She supported the response since summer of 2020 and was a member of our community-based COVID-19 testing team. The locations of our mobile testing sites change weekly based on community needs, and this ranged from Northeast Baltimore to Cherry Hill and Brooklyn. Ms. Taylor willingly worked at every location assigned, officially serving as a COVID-19 tester, collecting specimens from clients. She was always willing to perform any of the tasks required to contribute to the successful operation of our testing sites. Ms. Taylor joined the health department in October 2009, and to date has served as school nurse at Lake Clifton High School, Northwestern High School, Patterson High School, and Augusta Fells Savage Institute for Visual Arts. She is currently assigned as the nurse for Digital Harbor High School. She also works 1 day a week at Baltimore International Academy East. Ms. Taylor's current duties as a school nurse include assessing students displaying symptoms of COVID, testing symptomatic and asymptomatic students for COVID, as well as performing testing quality assurance observations in city schools. The ARPA funding being received by the health department will help support team members like Ms. Evans, Ms. Bobolinichi, and Ms. Taylor so they can keep doing the amazing work of saving lives. Before I discuss just a few ways in which ARPA funding will be used, it's critical to note that many health department employees who were pulled from their original posts in March of 2020 are still key personnel in the response, now some 19 months later. Many of them continue to do both COVID-related work and their primary job responsibilities. The ARPA funding will support the health department's operations in many ways, and importantly, it will allow members of our team to return to their pre-pandemic responsibilities full-time. One area where we will use ARPA funding is to support the expansion of testing. As Mayor Scott mentioned, with this funding, the health department will be able to provide tens of thousands of at-home rapid COVID-19 tests for Baltimore City residents to ensure that our surveillance program remains accessible and in place. Additionally, the funding will allow for dedicated testing staff, allowing some of the staff members who've been performing COVID-19 testing to return to their pre-pandemic duties. Likewise, contact tracing has been a key component in our pandemic response, and the work of our contact tracers, call center agents, and outbreak investigators have been critical to keeping our residents safe. Again, many of these key personnel have been pulled from other divisions within the department or hired on a temporary basis. This funding will allow us to shift some of those positions to more permanent ones and allow some of our staff members to transition back to normal non-pandemic duties while still maintaining the robust surveillance and reporting program here in Baltimore City. Meeting our residents where they are requires the health department to shift to more telehealth options. And we're pleased that a portion of our funding will be used to upgrade our current patient portal that's in use in our clinics. To give an example, our current system doesn't have a patient portal for patients to request appointments, view their medical records, view test results, or communicate with health department clinicians online. The ARPA funding will be used to establish the technological infrastructure capable of supporting telehealth. We look forward to launching this new telehealth program towards the end of 2022. ARPA funding, as mentioned by Mayor Scott, will also support the continued efforts of our immunization office, who is marching steadily towards the goal of vaccinating 80% of Baltimoreans. It'll help us to replace contractual staff with 11 permanent staff members. The health department will continue to focus on vaccinating the hardest to reach communities in our neighborhoods with the lowest vaccination rates. The team will also be supported by 24 community health workers who will transition from contractual to permanent status. Working closely with our communications partners, our vaccine peer ambassadors will also continue to have those difficult face-to-face conversations and perform different training sessions with our hesitant communities. ARPA funds will allow us to take the results from surveys currently being implemented at our vaccine clinics and implement their recommendations in a new and fresh way in the upcoming winter and spring months. These staff will additionally be trained to outreach families with children between the ages of 5 and 11, and subsequently those under 5 once vaccine eligibility formally expands. This transition will occur over the first 6 months of 2022. These are just a few of the key areas where ARPA funds will help support our ongoing mission. I would be remiss if I did not take a moment to also thank some of our other partners who've been involved in the pandemic response here in the city, including Coppin State, Morgan State, Johns Hopkins Medicine, the University of Maryland Medical System, Care First, Blue Cross Blue Shield, Baltimore City Community College, MedStar Health, Ascension St. Agnes, Bacor Shalom, the Baltimore City Fire Department, Baltimore Medical System, CVS Health, Esperanza Center, Family Health Centers Baltimore, Giant, FEMA, Healthcare for the Homeless, Jai Medical, Kaiser Permanente, the Tri-Center at the Lord Baltimore Hotel, Lutherville Pharmacy, the Maryland Department of Health, Mercy Hospital, the National Guard, Northern Pharmacy, Notre Dame of Maryland School of Pharmacy, Park West, Rite Aid, Safeway, Sinai and Lifebridge, Total Healthcare, the University of Maryland at Baltimore, and Walgreens, just to name a few. Through our combined efforts, Baltimore City has risen to the challenge of the pandemic response. And while there is still much work to be done, we certainly are further along the path than many would have guessed. The work of supporting the pandemic response has been arduous, but I stand before you extremely proud of the work the department has done, and I look forward to a continued and optimized response with the support of the American Rescue Plan Act's funding and under the distinguished leadership of Mayor Brandon Scott. Thank you.
Thank you, Dr. D. I think it's safe to say with that list, I have to invoke the spirit of Congressman Elijah Cummings and say we thank Lottie Dottie and everybody for helping Baltimore make it through COVID. And with that, we will close and take questions about today's announcement. Ava Joy, can you come to the mic? Because they're going to probably put this on Charm TV and they want them to be able to hear you.
Can you hear me?
Yes.
Can you talk to us about the testing kits and the at-home testing kits and who will be getting those? Will it be essential workers, city employees, or just any resident?
I'll let Dr. D walk you through that process. This is something that they do now. We're trying to expand that work. Dr. D?
No, the mayor touched on it, so we've launched a small pilot around this now. And again, we're thinking about those communities that maybe have less access. So similar to our mobile testing efforts, where we've really focused on deploying resources in areas with highest % positivity, or just with not a lot of access to other testing locations. Similarly, we've tried to identify areas in the city that have less access and have distributed so far. Again, a very small pilot program, but the hope is to, again, expand that.
Okay, great. I wanted to ask a question about the vaccine mandate here in the city. Can you talk to us about where things stand right now? Will there be consequences for city employees who do not show their vaccine or do the weekly testing?
Well, we have a process in place. We know that that process is just kicking off, and we know that listen, when you don't follow rules and regulations, there are always possible consequences. As we go through now, as we're just beginning this, the testing and everything is just getting into gear. We're going to see where we are, and hopefully we don't have that, but we will be ready to respond accordingly.
And one last question, can you talk to us about the logistical challenges with getting this up and running, like the testing, where people are going to be tested, who will do the testing?
Yeah, we have folks that are going to be doing the testing for us through vendors. The city employees, we have spread those sites all across the city to make sure that our workers are able to get to these places that are close to their workplaces, making them at a wide range of hours so that we can have the access necessary. It is a heavy logistical a lift, but it's not uncommon that other cities and places have done. We have to do this in order to protect our workers and our residents that they're going to be interacting with.
You know, we spoke with the fire union president, and he said that they didn't have details that you just mentioned. They don't know where these testing sites will be. Is this something that will be coming out later?
So a couple of things. One, we know that the information is shared with the employees and the folks there. Everyone will have the appropriate information so that they can get themselves tested accordingly. Thank you, ma'am. I was gonna say, Dr. D's gonna get mad if we keep passing that mic. Make sure we put it on the stand.
Good morning.
Hey, ma'am.
My question is for Ms. Kearney. It's just about the application process for the $80 million that was allocated today. I'm wondering if it was submitted by the health department, and if so, can you talk about the application process and sort of let listeners understand what values you were looking for, all that fun stuff.
I'll start and let Shemaya come in. So yes, this was submitted by the health department. This was a process that we set up for our agencies to submit their proposals. As we heard, and Shemaya will go into the details. When you think about what this money was intended for, COVID-19 and COVID-19 recovery, but also for us to focus in on equity. I've been very clear throughout this process that we want this to reach the people and neighborhoods that have been ignored for so long, that this pandemic has exacerbated so many of the negative things that have been existing there in those neighborhoods. And I'll let Director Kearney walk through the rest of the process.
I apologize that I didn't hear the entirety of the question, but I think you were asking about the application process. Is that right?
Exactly.
Okay. So for the application process, what we've done is we allow for agencies to submit what we call proposals that will outline the activities and programs that they plan to initiate with ARPA funding. We work with those agencies to identify implementation plan, sustainability plans, as well as with budgets. In addition to that, we have a review team that reviews proposals and scores them according to 7 criteria, with equity being the highest weight. You've heard Mayor Scott mention on numerous occasions that he really has an intent focus on making sure that these funds are equitably distributed, but with a real focus on marginalized communities. And so in that process, equity is the highest weight. Once we get to that point, we then have conversations with the mayor and city administrator around size, scope, and scale, and make recommendations accordingly, and they make the decisions about our final amounts.
Great. And just to follow up, did any proposals from the health department get rejected?
No. No, this was the major proposal that they've submitted. There may be others that the health department may submit, I assume maybe so. And so we will evaluate those accordingly as well.
Thank you.
You're welcome.
Ma'am?
Hi, Mayor. How are you feeling?
I'm good. How are you?
I'm good, thank you. Can you talk about how many nonprofits have already submitted through the portal for funding?
So far, 13.
13. And can you talk at all, any hints about what these upcoming announcements will be? Will any focus on crime?
So I think that we've already made that known. That is a part of, as we joined the president's, one of 16 cities for the president's program of using ARPA funds for violence prevention. We know that will be one. The rest of them we will tell you guys about in a later date.
Thank you.
Yes, ma'am. Thank you, everybody. Anybody else? Thank you.
Oh, wait.
Oh, sorry, sir.
Oh, no.
I couldn't see you back there.
It's all right, Mayor. Just a quick housekeeping question. For all of the monies going out to contract laborers and others over the past 19 months, can any of these monies be used for the city to recuperate unexpected expenses or things that have drawn down other budgets?
So yeah, one of the approved uses is for budget restoration, and we'll be looking at that and talking about that at a later date as well.
Can you give us any kind of estimate as to how much unexpected money the city has put out just on the COVID, on the pandemic side?
We'll be sure, we'll send that information over to you direct, but we know it is a large amount of money. But thankfully, we've had CARES Act and other dollars as well, in addition to now with ARPA. But no, every city had to expend, every government, every business really, had to expend money that was unaccounted for due to the pandemic.
Thank you.
Thank you.